Namami Ramam Raghuvanshanatham. I am Dr. S.K. Singh, ex-DPCMO CCL. I am here to discuss about a drug which is well known to our society, that is paracetamol. Paracetamol is commonly used in fever and pain, but unfortunately, this has become a practice that people are going to the medicine hall and purchase it without prescription of a doctor, and medicine is provided to them, or it is it has become a common phenomenon that if a doctor prescribed paracetamol, we repeatedly use this medicine to our kids. I can't say that patients are not taking advice from the doctor. They take the advice from the doctor and go to the medical shop and they purchase paracetamol. It is normal practice. Any medical hall never tries to provide paracetamol without prescription of the medicine by the doctor. But when we are eating paracetamol in pyrexia means fever, we must be conscious about the fact that it may cause hypothermia. Let it be clear, what is hypothermia? Hypo means come, thermia means temperature. The patient may suffer from hypothermia. उसका तापमान आवश्यकता से कम हो सकता है. And in that very case, we suffer a lot of problems, especially in night when we take paracetamol and it causes hypothermia. We have a lot of problems. Beware of that two stages of age which are more common for hypothermia. Hypo means come, thermia means temperature. Our average temperature is lower than the normal temperature. That is called hypothermia. In that very case, we have no idea, a layman has no idea how to recoup the lost temperature, and it may be lethal sometimes also. It may take the life of the patient. Be careful. In those conditions which are hypostatic ages, hypostatic means in childhood and old ages, in my experience, I have felt that hypothermia comes frequently, and we give paracetamol more than required to our kids, and baby may cry due to hypothermia. Temperature becomes down, body cools down. So, if baby suffers from pyrexia, we should use cold sponging, washing of the hand and feet and body with cold water. This is the best method to lower the temperature. If it fails, we may use paracetamol, but that very paracetamol must be taken advice from the doctor, how many milligram should be given to a baby 1 year old, 2 years old, 3 3 years old get pyrexia. Pyrexia means fever, and we frequently use paracetamol syrup. So many brands of paracetamol syrup are available in the market, but since we don't know the actual dose of the paracetamol, so we get a lot of problems. The condition, the weight, and the age of the patient is called for the medicine. A clinician always sees all these points, and according to age, according to weight, and according to severity of the disease, clinician prescribes paracetamol to the babies, and that very paracetamol is useful. We should take, but sometimes even in clinical doses, hypothermia may ensue, may occur. We should be aware of that very fact, and we should warm the baby by rubbing it, by giving hot cloths, by giving hot drinks, hot milk, tea, etc. extra. In hypostatic cases, we must consider the old age people more than 70 years of age may suffer from hypothermia. Hypo means come, thermia means temperature. Due to use of paracetamol, even the clinical dose of the paracetamol may cause hypothermia, and we suffer from hypothermia. We should be careful about the fact that the medicine should be taken in a full stomach. The medicine should be taken in a full stomach, and we should watch the patient, the temperature is coming down slowly or not. If temperature is coming slowly down, then we should be satisfied. And if temperature is lowered, more than normal, we should rub the body of the patient, massage the patient with mustard oil. We should give hot cloths over him, hot drinks. I think the person may regain its temperature if the person does not get his normal temperature. We should refer the patient. We should come to the clinician, a equipped hospital, as early as possible. We should know that hypothermia, hypo means come, thermia means temperature, is also a dangerous condition, a deadly condition. We should keep ourselves, have a safe distance, and we should use the paracetamol with the permission of the clinician. Again, I repeat it, and clinician will see the patient according to age, weight, and severity. He will provide, and he will advise you to take the paracetamol, how many times, and what should be the weight of the medicine. We used to take this medicine in pyrexia, in fever, but paracetamol is also a good medicine for pain. But anything which you do excess is bad. It has action on liver. So we should know that paracetamol may damage our liver. So we should be careful, be conscious, and use the paracetamol as per the advice of the clinician and as per the condition. Randomly, without knowing the actual fact, we must keep ourselves away from this medicine. So, in this video, I have narrated that hypostatic cases in kids and old people hypothermia used to see even in clinical doses. Even in clinical doses. So we should use paracetamol, but after the proper advice of the clinician. And if any unwanted reactions like hypothermia ensues, comes, we must take the shelter of an equipped hospital or a doctor where we may be treated and may save the life from hypothermia. Thank you.